Okay, this is Diana. Let's go ahead and practice the screen sharing.
All right, so just making sure I can do this. Can you see it?
That looks good.
Okay, and then I would just go to slideshow and from beginning, correct?
Yes.
That you don't see the sidebar. All right, perfect. I'll stop.
What I do see is the notes on the side, the slides on the side also.
Okay.
If you want to.
Did that fix it?
That fixed it.
All right, perfect. Thank you so much.
You're very welcome.
Okay.
Hello, Chris.
Good morning.
Good morning, Chris.
Yes.
Okay, are you at all presenting or listening?
I am just here to answer questions if they have them regarding the health interlocal.
Okay, good. Let me see. Okay, I will make sure you are allowed into the meeting.
Thank you.
Mike, how are you?
Hi, Diana. How are things?
Things are great. I'm ready when you are.
Oh,
Um,
fabulous.
So tell me, Stacy, is Deshane Barnett, is he need to be in the first round? The COVID funding?
I'm gonna
Yes,
look.
please.
Yes, please.
Okay, he's been promoted to panelist.
Lovely. All right, folks. Well, I'm gonna call today's Public Safety and Health Committee meeting, Public Safety, Health and Operations Committee meeting to order. It is June 8th. We continue to meet in a hybrid format with council committees on Wednesdays being all Zoom, and that hopefully folks have figured out how to continue to be in touch with us while we navigate all the things. We have a pretty jam-packed schedule today, so I'm going to get right to it. Diana, if you wouldn't mind doing a roll call, that would be lovely to start us off.
Starting roll call, Stacy Anderson,
Present.
Daniel Carlino,
Present.
John Contos,
Here.
Merta Becerra,
Present.
Jordan Hess,
Present.
Gwen Jones,
Present.
Kristen Jordan,
Present.
Mike Nugent,
Present.
Jennifer Savage. Jennifer,
I think, is going to be joining committees later in the day, so I don't think she's present today.
Okay, Amber Sherrill,
Present.
Sandra Vasica,
Present.
Heidi West.
Present.
Thank you.
Thanks, Diana. I appreciate that. All right, so we have approval of the minutes from the last time we met, which was May 11th. Any additions, amendments to those minutes? Okay, seeing none, those will stand approved. We have 3 agenda items today. The first one being a presentation from Dale Bickle on additional COVID funding. And so I will hand it over to Dale to present this item.
Good morning, council members. This request is to actually continue some pandemic response funding for the health department and its employees, and Deshane, our health officer, is here to describe that.
Good morning. I didn't want to interject during business, but if we could also get Chris and Anna Conley, so Chris Lounsbury, Anna Conley, they'll for the next item, they're going to contribute. This one I can cover on my own. So what we are looking at is we have scaled back our response operations significantly, and that's largely due to the federal funding source that covers our testing and vaccine activities we're planning that it'll be going away at the end of this month. And our case monitoring, case investigation, and contact tracing, those activities have not been federally funded now for a while. So what we have done in response to this is we have closed our testing center. And so that closed as of May 19th. We closed vaccines in April. And in doing so, we worked with providers out in the community to make sure that there was plenty of coverage before making that move. We cannot, however, just stop doing case investigation. That's actually, COVID is still a reportable disease. We have a requirement and a responsibility to contact trace, to investigate, and to report. But what we're requesting to do is do that with just a skeleton crew moving forward. We now have technology in place. A lot of that work will be done via web form and through text messaging. So we're not going to have a full response team of 40 people like we had going at other times during the pandemic, but we are keeping a skeleton crew in order to make sure that we can keep up with cases and do the required case investigation and reporting. And so that's what this budget request is for. Right now, we are planning to for the budget, we're planning through the end of this calendar year, and then if we still have instructions from CDC that we continue to report, we'll come back and address that as needed. But right now, we're just planning through the end of the calendar year.
Great, thanks for that presentation. So Dale, it looks like the ask is to allocate 120,000 of our American Recovery Plan Act, get that out, to allow for this work to continue.
Yes, and we wanted to do it ahead of the budget process here because we needed to have this decision made. Obviously they wanted to continue this continues in July. And so we wanted to get this in front of council ahead of the budget process so we could just keep them on staff.
Great. Thanks for the clarification. Okay, so I have a couple hands raised. I will start with Ms. Cheryl.
Yeah, thanks. And I appreciate the update, Deshane. Being on the health board, I can't. It is shocking how much the response to this pandemic has cost for our county, for our health department, for the entire country. So I specifically kind of want to give a shout out to Deshane for working really hard in some of the areas that weren't being reimbursed to be smart about it, get it a little more automated, save some money there. So I guess I just want to say thanks for that and being responsive. And the earth was kind of shifting under all of us regularly during this pandemic, and I just think we did a good job being as responsible with funds as we could. Again, I want to say, because we had a lot of conversation around this at the health department around contact tracing, especially when things got super crazy and we weren't sure how effective it was, that we do have a legal responsibility to do this, as Deshane pointed out. So we're going to have to continue doing whatever we have to continue doing as far as that's concerned. But those are just my comments. This has been a real effort. I'm glad that we have these funds available, that we can allot to it, and I would be happy to make the recommended motion.
Great, thanks so much. That motion is in order. Per our new rules, we will go to public comment on the motion, but I see no public. So I also want to note that there was no public in place I didn't ask for general council comment. So moving on, we will now move to Ms. Jones. Gwen, you're on mute.
Thanks for that. I was all ready to make the motion, but Amber beat me to the punch on that one, which is fine. And I did just want to make a few comments. I just looked back at the last 2 years and the incredibly steep learning curve that our health department had to climb as this unprecedented situation unfolded in front of us. And I know how much work Ellen put in, and Deshane has picked that baton up and is running forward with it. So thanks, Deshane, for all of your work. And the other thing I wanted to say is I'm sure that at some point we're going to nationally, but also on a local level, I hope we kind of have this lessons learned and best practices for the next time around. And I'm sure you're tucking that back in part of your brain as you're just keeping all of the lids on top of the boiling pots of water right now. But thanks for everything that you're doing. And as you said, we are still in this pandemic, even though it kind of feels like maybe we aren't, but we are, and it's still here. So I'm very supportive of doing what we need to do now to continue to track and monitor this whole situation and support this.
Great. Thanks, Ms. Jones. Deshane, I see you have your hand raised.
So I'm not sure how the process goes, so I didn't want to just start talking. So two quick things. Yes, we are absolutely going to do a look back process. And I think there are a lot of lessons that we can learn and carry forward. And I just want the council members to know that, yes, we absolutely will do that. I also, since this is a budget request, a financial request, I did want to correct some misinformation that made its way into a Missoulian headline that said that the health department has been overspent by more than $3 million. And I just want to clarify, overspent means that the federal government or state gave us funding and we purposely spent beyond that amount. We were not given funds. We had to do our job. We had to do this response. We spent money to do that response, knowing that it wasn't covered. So I don't want the impression out there that the health department is fiscally irresponsible, that we had a budget and we blew it by $3 million. We did the work and we will continue to do the work, and we will be as fiscally responsible as we absolutely can in doing that work.
Great. Thanks so much. That is a really important clarification, because I think that, boy, if we didn't realize the value that city, county public health departments gave, this was, an unfortunate way to really realize that we need to fund them adequately, and the services that they provide for the community are critical. And, no one could have predicted this for sure. I guess my question is, it does feel to me as though there does seem to be a rise in cases. I know personally, I feel like I know a ton of people who have COVID at the moment or have just recently had it, despite 2 years of not having it. And I've seen a couple things where I think Lewis and Clark County is sort of tracking on higher community numbers, and Glacier Park just put out an announcement saying that because of community transmission, they're asking that folks wear masks in there. It is always a dance in terms of like what needs to be done and what you're prepared to ramp up to. I mean, I guess my question is this enough? Are you feeling because of budget constraints, you're having to scale back to a place where you are not in a position to ramp up if need be moving forward, given we have no idea how this is going to continue to unfold with the next variant, et cetera?
That is an excellent question. I do pride myself as an administrator on being fiscally responsible. However, I am first and foremost a public health professional, and I will always put health before I put money. And this is actually not just a reflection of the fiscal environment. It's also a reflection of the public health environment, where, yes, we absolutely do know that cases are rising here in Missoula. We know that, and we know that the cases that are reported are an undercount. We have folks who are either not testing or are testing at home and not self-reporting. So our reported number of positives is actually an underreported, and we do know that. The environment that we're in right now, though, is that we have worked very hard with the providers in our community, and both testing and vaccines are widely available throughout our community. And the other part of this is therapeutics. And before we decided at the health department to scale back operations, what we really wanted to see was that hospital capacity was being preserved. And with the therapeutics, the testing and the vaccinations all widely available, that should continue to be the case. As of yesterday, even with the rising numbers, we only had 2 individuals hospitalized with COVID. And so that will really be our focus. As soon as at the health department, we see any indication of hospital capacity being in jeopardy, or even if there is just a broader need, we will absolutely jump back in the game, play that role. We'll have to come back, obviously, at that time and look at what budget and finance looks like, but we will absolutely get back in the game if needed.
Great. Thanks so much. Expected that to be your answer. All right, folks, we have a motion on the floor. We have no public, see no more hands raised. So happy to have Diana do a roll call vote on this motion.
Starting the vote, Stacy Anderson,
Yes.
Daniel Carlino,
Yes.
John Contos,
Yes.
Merita Becerra,
Yes.
Jordan Hess,
Yes.
Gwen Jones,
Yes.
Kristen Johnson,
Yes.
Mike Nugent,
Yes.
Amber Sherrill,
Yes.
Sandra Visica,
Yes.
Heidi West.
Yes.
That gives us 11 yeses and 0 nos. Thank you.
Wonderful. And just tiny correction to the record. It's actually Kristen Jordan. So I want to make sure that gets counted correctly. All right,
Thank
great.
you.
Moving on to 3 point. It's confusing, I realize, with a Jordan Hess and a Kristen Jordan. So we understand. All right, so moving on to 3.2, we continue to have Dale, Deshane, and crew to talk about an interlocal agreement with Missoula County for health services. So once again, Dale will lead off and hand off to other presenters.
Yeah, thank you. Dale Bickle, Chief Administrative Officer. I'm just going to introduce the topic a little bit, and then I think Deshane will provide most of the presentation here, but joining us are Chris Lonsbury, the Chief Administrative Officer of Missoula County, and Anna Conley, who is the Chief Civil Deputy at the County Attorney's Office. So as a result of the last legislature, a bill was passed that essentially not took away, but provided an extra layer of decision-making relative to health board orders. And so that requires a governing body to be able to do that. And various cities and counties across the state are dealing with this now. The way that Missoula County and the city of Missoula looked at this is, rather than creating a whole new governing body that is comprised of the Board of County Commissioner, members of the Board of County Commissioners and members of City Council, is that we kept the governing bodies intact and created a mechanism for those two governments to work together to review the orders that are created by the health board. But I will let Deshane talk about that in more detail. Thank you, Deshane.
Yeah, and then like Dale mentioned, I've got Anna and Chris here to back me up. But so I think many of you all are aware that in the legislative session, what would be now 2 years ago, several bills were passed, including HB 121 and HB 257. And what those House bills did was necessitate that we make a change to how we do business in regard to the Board of Health. And so this interlocal, this new updated interlocal, what that does is responds to this need to create a governing body separate from the Board of Health. And so I'm going to talk about a couple things, and I'm sure I'll miss something. And so Anna and Chris are here, and then we'll do questions because I know I'll miss stuff. So because it is a lot. It's the Board of Health used to have the authority to adopt the health code. And so the Board of Health established health code, and under these new bills, that is no longer the case. And so the governing body now has to be the one to put health code into place. There's a couple exceptions there. That does not apply to emergency rules. Emergency rules are deemed valid throughout the duration of the emergency unless the governing body repeals them. So the governing body has basically veto power, and the governing body can repeal an emergency rule. But if they don't repeal it, that emergency rule stands through the duration of the emergency. It does not apply to property specific actions. So for example, if we have a situation where, you know, a restaurant, as the health officer, I have to go in and act in that authority, and I put in a health officer order, and we need to maybe temporarily close that restaurant, something like that. That does not apply here. That authority remains with the health officer. And then any request for a variance or appeal to a notice of violation, that still goes through the Board of Health. That does not go to the governing bodies. So the Board of Health, under these new laws, still maintains a certain authority, but then what it doesn't have authority over is to establish and adopt provisions of the health code ongoing. So the governing body will now be responsible for that. And like Dale mentioned, what we chose here in Missoula is to really have both the city commissioners, the county commissioners and the city council continue in their capacities as the governing bodies. Other counties chose other approaches. So some counties completely created a whole new body. They maybe pulled in 1 or 2 members from a county, 1 or 2 members from cities, you know, and that's the approach that they selected. For us, we went through a process where we met. So we had myself, we had administrators from the city, administrators from the county, attorneys from the city, attorneys from the county. We really thought through this process, and the process that we felt like really validated the role of our governing bodies the best is that the city council will have this authority to either set health code or repeal emergency codes within the city, and the county commissioners will have that same authority outside the city within the county. Now, the way the process is set up in the interlocal is that we hope and expect that it goes smoothly and that the county and the city both want the same thing. The Board of Health is still the one who proposes the ordinance. So we propose it. We hear back from both the city and county like, yes, we're going to put this through our process, but we are fully in support and we expect it'll pass. That's great. Then we just let those 2 respective processes play themselves out. If, however, the Board of Health recommends a rule, which in the city is an ordinance, and we hear back, say, from the city that, no, we do not agree, we do not think that this is going to make it pass, then what we do is within this interlocal, we call for a joint meeting. We try to come to an agreement between the city and county of what the new rule could or should look like. And then if there really is no agreement, the city is adamant that it needs to be one way and the county is adamant that it needs to be the other way, then those separate rulemaking processes play out, and the new rule or ordinance will only apply within the jurisdiction of the governing body that either approved it, or it will not apply in the jurisdiction of the governing body that did not approve it. That's potentially, you know, it could get a little wonky. What it means is we could have a situation where something is legal in the city, but not outside the city limits within the county, or it could be legal outside the city limits, but not in the city. And that's okay. We already have that. We already have some instances where the city rules and the county rules differ. We don't expect, this is largely course of business work. We don't expect that there's going to be a lot of times when the city and the county are going to strongly diverge on health code. So that's why we chose to set it up in a way that still respects the jurisdiction and authority of both of these governing bodies. And let's see, so I have my little notes. What happens when the counties don't agree? Oh, another change under this, the Board of Health will no longer hire the health officer. So the health officer is a county employee. And so as a county employee moving forward, they will be hired by a process that's led by the county commissioners that does include, if the city council chooses, you can appoint someone to the search committee. You don't have to, but you do have that role. And then that search committee will make the recommendation to the county commissioners, and the county commissioners becomes the hiring body for the health officer moving forward. And so that is for a search. That is not for a renewal. And so anytime there's a search for a new health officer, that has moved out of the Board of Health to this larger process. And another big shift in this interlocal is that the building costs associated with the health department are now going to be shared between the county and the city. In the previous interlocal, they were not shared. The county had those costs 100%, but that's because the city had 100% of the cost of OPG, which was the Office of Planning and Grants. That office, Dale and Chris could talk much more to this. I don't know why it went away. So because that went away, there is no city share for that cost. So the prior agreement of the county will do the health department, the city will do OPG, doesn't stand because OPG doesn't exist anymore. So now it's just the city and county are splitting the cost. The way we split costs right now is 60-40, but we didn't want the city to have to take on 60% of our building operational costs in the very first year. So the way it's set up in this new agreement is that in the first year, the city will take on 20%, and then it'll increase by 10% for 5 years until it gets to that 60-40 split that we're currently at with personnel. So Anna, Chris, Dale, I'm sure I missed something. So please hop in, and I'm happy to answer questions.
Thanks so much for that, Deshane. I was tracking that during the legislative session and was curious on how we were going to adopt that, and just I have lots of opinions on why the legislature did that, but this is not the time or place. Dale, I will see that you have your hand raised.
Thank you. One more piece of the interlocal I just wanted to highlight was Deshane talked about the 60-40 split, and that has been historically the split in the amount of tax support that the city provides the health department versus the county. And we're a little bit different in that the county has a special mill levy that is only levied on properties outside the city limits. So in this particular case, their 40% represents that rural only mill levy versus the city levy, which is only on city residents. And so what this does is clarifies that we are responsible, and that and we will remeasure that based on changes in the taxable values inside the city versus inside the county outside the city limits. And so there'll be true ups every couple of years, I think, under this interlocal to do that. But right now, the basis is we're starting out at 60-40, which is what we've been at, but this is that clarification in there as well.
Thanks so much for that, Dale. I guess my question, you then prompted a question. I know, how does this affect, because the county has a special mill that's assessed to properties and we do not, how does this affect our mill cap?
The health department, the general fund allocation to the health department, the way we budget today, is subject to our mill levy cap.
Great. Okay. Very good to know. All right. I see Miss Cheryl has her hand raised.
Thanks. I didn't know if Anna had anything to add. She popped up on my screen. If not, I'll go ahead and ask my question.
Hi, thanks for having me today. A couple of things I just want to emphasize as a counsel for the health board, which is obviously the health board still has a super important role, especially based on their subject matter expertise. And this isn't displacing their analysis of amendments to the health code. It's simply making it so that instead of them just blessing it and it being done, they hear staff reports, consider proposed amendments, and then they make recommendations to the governing body based on their expertise and the board composition that is focused on that public health expertise and environmental and clinical health. So I just wanted to emphasize the importance of the health board's continued role, number one. And then also I help the health department enforce the code, and from especially an environmental health perspective, it's really important that to the extent possible, the rules do stay the same, because when you're training sanitarians and when you're explaining things to the public, it's really best if the rules are the same countywide, especially with regard to solid waste and things like that. And so I think that's the hope, is that, like DeShane said, there won't be a divergence, and that there is a mechanism for the health officer to request amendments to the health code to be considered in a joint meeting. And I would just encourage that to be the goal, which is to continue to have that continuity across city and county. That's it. Thank you, Cheryl. Thank you, Amber. Sorry.
Great,
That's
thanks.
a problem. That's a problem with having a woman's first name as your last name. Stacy, would you like me to go now?
Yes, and I guess I just wanted to also, you prompted that if Chris Lonsberry from the county has anything that he would like to add, happy to give him the opportunity.
Again, like Anna said, thank you for letting us be here today to talk about this. I don't really have anything to add other than I really appreciated the process and the involvement of some of the council members during the discussions on this. It goes to fortify that strong relationship that the city and county have always had around the health department and the health code. And I think this interlocal sets us up for a continued solid future in that direction. So thanks.
Great. Thanks. All right, Ms. Cheryl, now the floor is yours.
Okay, thank you. First, I want to thank everyone that worked on this. I know this was probably a really big lift to work through this, and I know it had been a really long time since we had revisited the interlocal anyway, although I think that this the change in state law required that. I'm glad we did it. I guess DeShane, or I'm sure more of you than just him know this, but with the emergency declaration, I may have missed this. Is that who has does the health officer, is that the one that has the authority to make an emergency health declaration? Or, and then we as a body have the ability to say, no, we don't think that's right. And like, can you talk about how that's put into motion, and just kind of I have some concerns around how quickly we can put that into motion. So I just want to hear a little more around it.
I can speak to that briefly. So either the health officer or the health board can do an emergency rule that applies countywide. In addition, a health officer can do an order that's establishment or property specific, right? So, during COVID, there were multiple health officer orders that were issued because they needed to be issued very quickly. And the health officer can issue that type of order that, again, is jurisdiction wide, to example, require masks or to require closing early or capacity restrictions, all that stuff that we saw. That can happen immediately. And then when the health officer does that immediately, then it is in place, it's presumed valid until the governing body changes it. And that's the same for a health board emergency rule or a health officer emergency rule. The health board emergency rule can only occur after notice and opportunity to comment in a scheduled health board meeting, which could be a special meeting or a regular meeting.
Great, thank you. That my concern is just the speed at which some health problems need to be dealt with. So, okay, thanks. I don't have any questions. I'm happy. I think this all sounds great, and I think it was very thoughtful and very collaborative on how we came to this, and I'm happy to make the recommended motion.
Great. Thanks so much, Ms. Cheryl. The motion is in order. Again, we have no public, so we'll continue. Does anybody else have any questions or comments on the recommended motion to authorize the mayor to sign this interlocal agreement? All right, I will just add my thoughts. Grin, thank you everybody for working on this. I know you all had more really important things to work on in trying to deal with all of this during the middle of a pandemic. And I think that this is a really thoughtfully crafted way of complying with the rule that the legislature imposed on county health boards. So thank you for everyone who's worked really hard on this. All right, no more comments or questions. So with that, we will go to a roll call vote on this motion.
Starting the vote, Stacy Anderson.
Yes.
Daniel Carlino,
Yes.
John Contos,
Yes.
Merita Becerra,
Yes.
Jordan Hess,
Yes.
Gwen Jones. Gwen Jones,
She might have had to momentarily step away, so because I don't see her camera on. So
okay, Kristen Jordan,
Yes.
Mike Nugent,
Yes.
Amber Sherrill,
Yes.
Sandra Vasika,
Yes.
and Heidi West.
Yes.
That will be 10 yeses and 10 yeses, 0 no's.
great. Thanks so much. Yes, we'll this passes and we'll go again on the consent agenda. Thank you, everyone. Dale, Deshane, Anna, Chris, for everything that you do for our community and joining us today in public safety, health, and operations. Finally, we will move. Wait. Oh, Deshane, yes. Would you like some parting words?
Yeah, sorry. I don't know if this is outside of decorum, but I also wanted to let the council members know, I know the email went to you all, but on Friday, June 24th, we are going to be having an employee appreciation lunch for our health department employees. And if any of our city council members would like to come and have lunch with us, we would love to have you there. So that is Friday, June 24th, 12 p.m. at the Bella Vista Pavilion. Some of you have already RSVP'd, but if you can make it, just let me know and I will make sure that we have food for you there. So thank you.
Thanks so much. That is perfectly appropriate. And sadly, I'll be out of town. Otherwise, would love to take the opportunity to thank all of the health department employees who have done just amazing, extraordinary work in absolutely unprecedented times. And thank you for your leadership and thank you for writing the memo so that future generations have some words of wisdom, because I like to sort of jokingly say that no one left us an operating manual for how to govern in a pandemic from 100 years ago. So let's not make that mistake again. So thank you all. All right, moving on to our third agenda item. It is a presentation from Councilwoman West on livestock exemptions for youth agricultural organization projects. I like to call it the Goats for Everybody presentation. Not really, but we will turn this over to Ms. West to present.
All right. Thank you so much, Stacy. I'm going to try and share my screen. I practiced earlier, so let's see if I can do it. So let me. All right. Can you see my presentation? All right, perfect. So this is a picture of my daughter, and she is holding her champion layer hen from last year's fair. We now have a giant trophy at our house for this chicken. But while I was at the fair, I ran into Emily Bentley, who posed the question of how can we get more urban youth involved with the county fair? And I think currently there are barriers that exist for participation. And so this is where the idea came from for a livestock exemption specific to youth agricultural organization projects. So right now, our current ordinance language defines what livestock are. It does exclude bees. So bees are not currently governed by our animal ordinance. That falls to state regulations. And the big thing that really keeps people, kids, especially in city limits, from participating in agriculture projects is that you have to have more than an acre in order to have most livestock. The exception, of course, being some chickens or ducks or quail, which are currently also governed by our livestock, by our animal ordinance, and we can have rabbits. All right, so I just wanted to quickly define what youth agricultural organizations are that are active in Missoula County. We have two. So one is 4-H and the other are the Future Farmers of America, which is, we'll just call FFA. So both of these programs are accessible to pretty much anyone who wants to participate. 4-H is run through the MSU Extension Service, and it's open to kids, I think, as young as 5. There's a clover leaf program that's for the younger kids. And then as you get older, you are a 4-H participant. The program year runs from October through the fair, and you have to enroll through, Missoula County 4-H, so through the Extension Office. And then Future Farmers of America is open to any of the feeder schools to our high schools, Missoula County Public School high schools. So that extends to schools like Target Range. So if you're in middle school at Target Range or at Hellgate, you can participate in FFA as a middle schooler, and then of course as a high schooler, and then CPS program. And let me see, next slide. So the goal of this exemption would be to increase the participation of urban youth in agricultural educational opportunities, and to in turn increase the participation of urban youth in the Missoula County Fair, and to more generally support local agriculture, increase food security, and reduce the number of food miles that products travel. So this exemption that I'm considering would specifically apply to meat animals that are auctioned off during the fair. So that would be goats, sheep, poultry. Laying hens are auctioned off during the fair, as well as our meat birds, ducks, and chickens. And so they can be then processed, they're purchased and processed locally, and then hopefully consumed locally. Right now, Missoula County 4-H has 5 market goats in their program, 47 market sheep, and 38 poultry projects. But most of the youth participating live in the county, and most of them actually live between Missoula and Frenchtown. So the number of students that would be participating within the city limits is much, much smaller. And we didn't, the spreadsheet didn't dive down into the details of like who lived in city limits or without, but just anecdotally, I think we are one of very few families participating in 4-H that actually live in the city of Missoula. So I found a really awesome a guidance document that was published in the state of Connecticut that has best practices for urban livestock. And one of the biggest pieces of advice were just to not reinvent the wheel, that there are state and national laws that often set regulations, whether it's water quality, air quality, and just management practices in general, and that those should be relied upon as often as possible. And things like what is in our zoning code, which currently requires an acre or more to have animals, is outdated. That comes from relying entirely on grazing to support animal life. And that is not how animals are raised today. And it's not how 4-H animals are raised. You have to reach specific weigh-in goals in a very short period of time. And that means that you have to supplement and really control the feed that animals get. And so there are obvious impediments. So things like steep slopes shouldn't be built on, they shouldn't impact our water quality, there shouldn't be runoff. But as long as those things are taken care of, you actually don't need large setbacks or large spaces. And in general, zoning regulations should permit the raising of livestock for FFA or 4-H or other student projects, which I don't think we would have anything that falls in the category of other at the moment. So I think I am put together this presentation for one reason, basically, is because this is outside of pretty much any work plan that staff is currently working on. So I wanted to make sure that I had the support of the rest of council to be able to ask staff to direct, spend a little bit of time on this. And I don't want to dictate how to do this. I think there are multiple ways that we could achieve this. You could either go through zoning, which I think is probably a challenging process to go, or we could create an animal permit process that's similar to our chickens, which would be in Title VI. And I've had conversations with staff in multiple different departments, including the city attorney's office, and this would be an allowable ordinance. And I've also talked to animal control, and they really just wanted to have access to things like addresses so they know where the kids are located, which of course, we all enroll either through FFA or 4-H, which means there is a database, there's contact information, there are responsible adults that can be reached out to, and there are also teachers and 4-H leaders that can help mitigate any issues that arise. And one thing that I forgot to mention is that all of these animals are actually it's a very short-term project. So kids would usually get their animals either in April or May, and then you take those animals to the fair in August. And so it's short-term, which means there isn't continued impact on neighbors. And I think one of the things that would be a challenge is to, mitigate issues with bears in the urban interface. And because of the timing of when animals would be in people's yards, it's not during those key times when we see the most negative interactions with bears. So I think some of those things are mitigated from the onset. So I was hoping to have something in place around October of this year, which is when the next enrollment period for 4-H starts. So basically you have to commit to a project in between October and I believe the end of December for the next year. And I think that's a reasonable timeline. And hopefully this would be a pilot project to see how animals, having livestock in our urban environment works. And then we can maybe discuss what that means for policy in the future. And then if anyone has any questions, I think that's kind of the end of what I've prepared.
Great. Thanks so much, Ms. West. We'll now take questions from council members. Again, want to note that we have no public in attendance. Ms. Cheryl.
Thanks. And thanks, Heidi. This is, I don't know, I know very little about this area. So I do have some questions though. Do you have any sense of like the amount of time that staff would need to put toward this? I mean, can you give me some sense of that?
I don't really. I think it really depends on whether it's just a permit that, we apply for. I think we could model it very closely after our chicken permit. And instead of our chicken permit, for people that don't know, is a 3-year permit. So this one would probably just be a 1-year permit. That is what would make sense that kids apply for, or maybe the parents apply for on behalf of the kids, every spring.
May I have a follow-up?
Yes, you may.
Well, actually, it's not a follow-up. It's another question. A follow-up question, not a follow-up to that specific topic. Do you, with the wildlife piece, that's kind of what came to my mind early as well on this. Have you had anyone weigh in from like FWP or any experts around kind of their concerns about it? I mean, that would be, I guess, my big thing is whether we're pulling bears and mountain lions into kind of our fringe, WUI fringe.
Yeah, I haven't looked at, I haven't talked to anyone yet. I just talked to animal control, but I did look over our current bear ordinance and our chicken ordinance, and they have very strict, guidelines on how you're supposed to store feed. And I think that, is in part to reduce those interactions. So I imagine those guidelines would be the same.
Thanks.
Great. Next up, we have Mr. Contos.
Yeah, thanks. I was curious, I might have missed this, but what was the motivation for wanting a zoning change or to allow animals like that in the city limits?
Yeah, so the motivation was a conversation I had with Emily Bentley at the fair last year that just posed the question of how we can get more urban kids to participate in the Missoula County Fair. And we happened to have that conversation in the chicken and goat barn. And this is, I think, one way that we could really broaden who can participate in the animal projects.
Madam Chair, may I have another question?
Sure.
It's coming. Yes, the animals in the city limits. So you said it was for a limited time?
Yes. So what I was picturing is that kids would be allowed to have their show animal and a companion animal, because you never want to keep an animal alone. So you would have your show, let's say your show goat and your companion goat, and you would usually you would pick up your animal sometime between April and May is when you would get your animal. And then you take it to the fair, which is usually the second week of August. So that is a really limited time window that you would actually have an animal on site. And then what usually happens is that within a week or two of the fair, all of those animals are processed. So they're butchered, and they're either butchered at Schoolhouse Meats or trying to remember what there's one other local butcher. And so, and then they move they move into the freezer. So,
Yeah.
So yeah, it's really it's a short-term window that people would have those animals.
I see. Okay, thank you. May I have one more question, and it'll be the last one?
Sure, go ahead.
Yes. By chance, had you talked to John Turner seeking his advice or what he thought about this?
Yeah, I have had long conversations with John Turner about this. So John and Aaron Turner run Turner Farms, but they're also the leaders for Blue Mountain 4-H, which is the 4-H club that we participate in. And his suggestion was that we should include pigs so that we could take pigs out and have less community pushback. But we're not doing pigs. I'm just suggesting goats, sheep, and then an extra set of chickens that would be temporary. And then rabbits, meat rabbits are another market animal, which kids don't usually do, but we're already allowed enough. You're already allowed to have, I think, 5 rabbits under our current animal ordinance. So we don't need to, we wouldn't have to change that in order for kids to participate in that project.
Thank you.
Great.
No pigs though.
Yes. We're having a very circle of life conversation here today. Miss Vasika.
Thank you. I think this is a great idea. I think we should include pigs too, but I'm not going to make any amendments or anything like that. Yeah, I think this is a fabulous idea, and I'm really happy that you're bringing this up. I have family that's in 4-H, and I think this is a great idea to get more urban children involved in this. So I would be very happy to make this recommended motion if it hasn't already been made.
All right, that is in order. Next up, and then like I said, no public yet here. We have Miss Jordan.
Thank you. Look, Heidi, I think this is such a cool idea. I just want to echo what Sandy was talking about, because I think, a lot of people have that dream of buying a big piece of property and having animals. And I think that keeping animals is a really good skill to learn, and for kids to be able to have that responsibility within city limits is super cool. And I'm really glad you're not doing pigs, because pigs are nasty and they need space. But thank you for doing all the groundwork on this. This is a really cool idea. I like it a lot.
Great. Next, Miss Becerra.
Thanks, Heidi. I might have missed this at the beginning, but would this be for only for 4-H enroll kids, or would it be for anyone?
So right now the language I'm considering is agricultural youth programs. And I think my thinking is that it's a program that has, so right now that would be 4-H and FFA, because I think those are the only programs, like official programs we have in Missoula County that I'm aware of. And it just, I'm limiting it to that for now because it has basically adults that, can be called if there's issues that arise. And I think if things work well, I don't know why it couldn't be expanded in the future. I just think that there's probably going to be some troubleshooting that has to happen. And, whether it's like what best practices are for things like animal waste, or, I think having an infrastructure that's existing that can help figure out some of those nuances is important before we consider broadening, who this applies to, if that makes sense. I want to be careful and intentional. And if it works well, maybe that's something that can be added in the future.
May I have a follow-up, please?
Yes.
So that made me wonder, like, how many goats would it depend on the size of the property, or for a specific project, and who would do the enforcement of this? Would it be part of the health department or animal control? And I get that this is at the very beginning stages, and you'll probably find all this stuff out as you move along, but just curious.
Yeah, so if it's a permit process that's similar to our poultry ordinance, then it would likely fall to the health department, animal control, because they would, that's who would get called if there's a violation, and they would show up. And I think it would require, communication with them up front to set up those information sharing systems. So, for example, if a kid has been cleared and has a permit to have 2 goats, and somebody calls them in, they can just cross-reference their list and say, like, no, that's an allowed project. Like, we don't even have to go out there. And then if there are issues arise, animal control doesn't necessarily have to take on the burden of solving that problem. They can call the parents, or maybe the 4-H staff person, and say, hey, like, this is the issue that is occurring, like, how can we mitigate it? And then it would be up to, the kids and the parents and people that have an agricultural background to figure out how to solve, whether it's smells or like runoff. I think would be a team of people that could help solve those problems. Does that make sense? Am I answering your question?
Yeah.
And I think as far as space requirements go, I think they're I'm envisioning like a minimum set of criteria. They're going to be slightly different for different animals' needs, but it needs 2 goats need shelter, and it has to be this minimum size, and then they need this minimum square footage of open space, if that makes sense. And I think that also is very similar to what is in our chicken ordinance, which has a space requirement per bird, I believe.
Yeah. Just quick follow-up.
Yes.
Yeah, because I was just thinking about like, goats are bigger than chickens, so they might require bigger shelter. Which would that be a permanent structure, or is that an ADU? Or like,
no, I don't.
How does that relate to our permitting process for zoning regulations?
Yeah, I don't think any of them would trigger the space requirement for an actual building permit. And I don't think, I think goats and sheep both can just have lean-to structures. Like, it wouldn't even need to be, as long as they have a roof, it doesn't even need to have, 4 walls. So I think they would be small enough to fall under, not trigger, what's it, 12 by 12, 10 by 10. can't remember, that triggers a building permit. They should all be smaller than that.
Great. And just one comment that I had is I remember when our Parks Department, the Morgan's crew would have, I think, goats on some city lands for weed control and weed management. And I'm wondering if some sort of partnership with 4-H would be, you know, a possibility.
I've tried pitching that, and they told me that they didn't think we'd have enough. I think it was sheep, but they didn't think there were enough sheep in the program because they really need a lot to hit those weeds. But maybe in the future we can figure out how to leverage these resources.
Mhm. Yes. Well, and I mean, I know there's a motion on the floor. To me, giving your presentation and what already exists and thinking about staffing, to me, it does make the most sense to fold this into where the chicken ordinance is, and it to be a permitting process so that there is, you know, because it already has language around feed storage, and it does seem like it, to me, it's a natural expansion of that program. And hopefully that would already have some of the sideboards necessary and would just need to expand. And this would be a pilot project versus taking on some of the bigger things like a zoning change to me. So that would be my feedback. But this is, you know, I think a cool opportunity to provide kids more opportunities to get involved. And okay, I see Mr. Hess has his hand up, and he'll be the final question because I want to try to be on time because we have a long day today, and this is our last item. So,
hey, thanks. I think this is great, Heidi. I'm really excited about this getting developed, and thank you for putting it together and bringing it forward. I was going to suggest, actually, Stacy just mentioned it, but I think I would favor going in the animal title as well, since zoning is sort of a one-time compliance certification. Typically, I think that makes a lot of sense and would be a little bit easier to modify. Wouldn't require planning board approval and whatnot. So that's. But I guess I had a question about how what the next steps are as far as staff convening to, I mean, do you envision there being a small working group or what would be the next steps as far as actually getting a staff group identified?
Yeah, so I was envisioning maybe a small working group, and I've already talked to, like I said, animal control and given and even land use staff and given people a heads up that this is something I'm considering. And then I've also done outreach, obviously, to Mr. Campbell, who runs is the 4-H extension agent, and then also reached out to folks like the Turners, who are leaders in that community, and as well as Emily Bentley at the county, just to gauge interest on the front end, and then to ask them if they would be willing to spend, you know, a little time. I don't think it'll be a huge amount of time commitment, but a little bit of time to at least provide feedback and expertise to making this something that's a functional tool for folks to use. So yeah, I think people are willing to participate, and so I was hoping that, I mean, you know, I'm not sure like how much or how intensive it'll be, but a small working group and hopefully not a huge time commitment.
Thanks. And a follow-up comment, if I may.
You may.
So I think engagement is going to be really important on this public. I mean, and I like that you're positioning it as a pilot project, but I think it'd be great if we could get an Engage Missoula site about this. And then also, I mean, it feels like a natural opportunity to do in-person engagement at the fair. And it seems like timing wise, that might coincide with your timeline. So just a suggestion there, but thanks again. I think this is great.
That's a great idea. Thank you.
Great, thanks so much. And yeah, appreciate all the work that you've done, looping in all of staff, city attorney's office ahead of time before bringing this to us. You've done your due diligence, and I'm happy to direct staff to take the continued run with it. And we'll see more as they have a work product. So with that, there's a motion on the floor. The motion is to direct staff to work on creating an actual not ordinance, but I guess, figure out where this best fits and how to legally make this pilot project a thing that can be participated in by the youth in Missoula. So obviously more on this will be coming down the pike when the final product gets presented to us. So with that, Diana, can you take a vote on this?
Starting the vote, Stacy Anderson,
Yes.
Daniel Carlino,
Yes.
John Contos,
Yes.
Merta Becerra,
Yes.
Jordan Hess,
Yes.
Gwen Jones,
Yes.
Kristen Jordan,
Yes.
Mike Nugent,
Yes.
Amber Sherrill,
Yes.
Sandra Fasica,
Yes.
and Heidi West.
Yes.
We have 11 yeses and 0 nos. Thank you.
Little future 4-H'er chimed in on that as well. So, okay. Thanks so much, everybody, for your time today. With that, I will adjourn Public Safety, Health, and Operations and see you all at 11:45 for Climate Conservation and Parks.